In the last 48 hours, we've performed 2 laparoscopic cholecystectomies, 1 emergency appendectomy, 4 colonoscopies, and 2 EGDs. We delivered 2 babies, one of them by emergency C-section. In the last 48 hours, we've saved the lives of 3 critically injured patients involved in a rollover MVA. I'm Dr. Jen Bruhl, and you're in Rooks County, Kansas.
Traveling across the rolling prairie of western Kansas, patients will come upon familiar forms on the horizon, created not by barns, silos, and outbuildings, images of their daily lives, but rather by the modern and progressive face of a new community health center.
Patients are extremely proud of the facility that they've built and they've supported. I've had so many patients come in and say, you know, we knew this would be nice, but we had no idea that it would be this nice.
From a patient's point of view, we've had nothing but positive feedback. Patients really like the fact that they get the same good care, but in a much nicer facility.
Located outside Plainville, Kansas, Rooks County Health Center provides state-of-the-art medical care to an ever-increasing number of patients for both inpatient and outpatient services.
We've seen new patients who were receiving their care elsewhere, going out of the city and out of the county to receive their healthcare services, now coming and utilizing this facility because they're impressed with what we can provide here.
And we're seeing an increase in the amount of ER visits, the amount of people who are admitted to the hospital, the number of people who choose to deliver here, just because of the new facility.
Replacing a hospital isn't easy going for any small community. It takes vision and leadership, and it takes that rare perseverance ingrained in the folks of rural America.
I mean, the economy is not an easy thing in my home county of Rooks, so it's not like they had an easy path, but they had leaders, and particularly some young folks in the community who recognized the importance of this project and decided to go to work. And I mean, there was nothing easy about it, and they had starts and stops.
Some days it doesn't look so good. Some days you wonder, is this all worth it? But today, walking down the hallway with our staff and our providers, and everybody seems to have a smile on their face. They're relaxed. This is a fun place to be at.
We would think, oh, this isn't going to happen, but you just persevere and it works.
I was frustrated when I first came here that we were a small hospital because we acted like a small hospital and we thought like a small hospital. And it took visionaries in our community leaders, in our hospital administration, and our hospital board to say we're not satisfied with that. And once the commitment was made to do something more and do something better, that we didn't let obstacles stop us. We remained dedicated to that vision.
It takes a lot of patience and fortitude to pull through.
I think maybe there were a couple of people who had the world savvy to say this is possible, but for most of the rest of us, we didn't know if we were going to be able to pull it off or not. But just with that leadership and that commitment and that rallying the community behind this project is what made this a reality.
Identifying the visionaries and leadership to move this project forward was just the beginning. It takes a committed and passionate board to rally the community and sell the dream.
Everyone that's in favor needs to be saying so.
Your board members have to be people, you know, that are just committed people. They have to be committed to that.
The board itself has to be totally sold out to the new hospital if they want one.
You just have to be committed to working with the staff and the administrators and trying to do the best you can.
I'd encourage every board to get actively involved, and you'll be surprised what you can raise. It'll surprise you. It's like anything, you know, it won't happen without some effort, but it can happen. Starts with the first step, starts with a dream.
Now my dreams can all come true, and now my life can follow through. Suddenly, it's all so clear, there's not a thing that I should fear.
And the board soon learned that it takes a dedicated effort to ensure the community understands why they needed a new hospital.
That was the most important thing, was getting the backing of the community. We knew that the board had vision, the administration had vision, but it was getting out the grassroots effort to let people know.
Yeah, you can't assume that they're going to understand, even if they've seen it in the papers. You know, we thought people had been seeing it in the papers, understood that the facility was just not going to continue to meet our needs. As a matter of fact, we were probably at some point going to get kicked out by the fire marshal. Our most effective means of communication was the informational meetings, and we have just a few small communities here in Rooks County, so we went to each of those towns in the county and made a presentation, and that was the time when we learned people were reading the paper but they didn't understand what we were doing. So we put together a PowerPoint presentation, we put together the numbers. We didn't make any assumptions about whether people knew more or knew less. We just started out as nobody knew anything, and kind of taught them the process that we had gone through that had taken us 3 or 4 years to get to. We kind of put it into about an hour-long presentation.
One of the things that really matters is whether or not their citizens can access health care. If you want a future of your community, you got to make certain that there are doctors and hospitals available to take care of the people who live there. And in the absence of that facility, in the absence of those physicians, you can't recruit new people to come to your town. Young families won't take the risk of raising their family where there's not adequate health care. And senior citizens will reluctantly move away, often to where their kids live, where there's a doctor and a hospital. They don't want to leave, but it certainly gives their sons or daughters the opportunity to say, hey, come live with us, come live in our town. We've got a great hospital.
The result of this community's endurance is a technologically sophisticated facility designed to meet the needs of a simple, unpretentious, hardworking people who appreciate the value of simple, unpretentious, hardworking buildings. Wrapping these amenities in an aesthetically unique design that complements the heritage of the surrounding community while ensuring the perception of a modern and progressive facility was the primary goal of the design team.
Every day when I walk through these hallways, it's just incredible. It's a dream come true, and I guess good things come to those who wait.
I would encourage any small hospital that has that vision for something better in their healthcare sector to pursue that vision, because it is very doable.
Where we're at today is because of decisions that were made 40 years ago. Likewise, the decisions that are made today here that we make today are going to be felt 40 years from now.
What was conceived are brightly colored hues painted on familiar forms of barns, silos, and sheds, and constructed of authentic indigenous materials of limestone, block, and corrugated metal. What was created was a destination that changes expectations.
Before, it was just like everything was squeezed into a tin can. And it's just a delight just to drive by there and know what's going on inside.
Yeah, I'll probably work here forever.